go.
Well, good afternoon, everyone. Thank you for joining us. We are here because times of crisis call for focused action and strategic coordination. Today, the state of Oregon, Multnomah County, and the city of Portland are each declaring a 90-day state of emergency to address the crisis of fentanyl use in Portland's central city, which we know has a ripple effect on the rest of the state. Fentanyl has taken center stage as a national crisis. Families, communities, healthcare providers, law enforcement are all struggling to find solutions. Fentanyl is cheap, accessible, and incredibly easy to overdose on. It is a drug that compels users to redose every 45 to 90 minutes. In practical terms, that means people in the throes of a fentanyl addiction can hardly walk into a clinic for help, wait their turn, and fill out paperwork without having to use again. The fentanyl crisis requires state and local government to respond with the highest possible level of coordination. Together, we must do more to increase access to treatment, and we must do more to hold individuals accountable for selling fentanyl and other dangerous drugs. The idea for a tri-government state of emergency to address the fentanyl crisis emerged from the Portland Central City Task Force late last year. I'm grateful to the Chair Vega Pederson, Mayor Wheeler, and all of the community members, lawmakers, business leaders who came together for that effort. Together, we came up with concrete actions that will help move our city and our state forward. And today, we are putting one of those recommendations into action. Effective today, the state, the county, and city declare a fentanyl state of emergency for the Portland Central City. Focusing the emergency response in Portland will benefit the entire region, state, and tribal lands, because we know that a large share of fentanyl in Oregon is trafficked through our major city. From the state, resources will be deployed from the Oregon Department of Human Services, Office of Resilience and Emergency Management, the Oregon Department of Emergency Management, the Oregon Health Authority, and the Oregon State Police. A combination of disciplines and existing resources will be coordinated and strategically deployed for the duration of the emergency. That will include peer outreach, behavioral, and public health resources to help individuals experiencing a fentanyl addiction access treatment and other stabilization services, and continued missions between Portland Police and the Oregon State Police to hold individuals selling the drugs accountable. Before I hand it over to my colleagues, I know a lot of today's discussion will focus on the technical elements of the emergency declarations. Well, let's not forget why we are here. The fentanyl crisis on our streets has destroyed too many lives, taken the lives of too many Oregonians. People are grieving, they are angry, and many feel helpless. My commitment as governor is to take on the toughest problems in collaboration with others to try to make Oregonians' lives better. I can't turn back the clock, but I can, working side by side with my fellow leaders and the mayor and the chair, to make sure our efforts are focused to the fullest extent possible on addressing this crisis. Individuals who are struggling with fentanyl addiction are worth investing in, fighting for, and providing a clear path to recovery. The health and safety of our neighborhoods is worth fighting for, and I believe this work will make an impact, and I'm eager to see where the results lead. And with that, I'd like to hand it over to the Chair of Multnomah County, Chair Vega Pederson.
Thank you, Governor, and thank you all for being here today. I'm really glad to be standing here with Governor Kotek and Mayor Wheeler. We know that individuals and families across the United States are suffering because of the devastating fentanyl crisis. It's important right now, in this moment, that we act with shared leadership to respond to the very human toll that fentanyl is taking on our community, including overdoses, fatalities, and day-to-day suffering. We know that despite past action, we've seen fatal opioid-related overdoses increase fivefold from 2018 to 2022. including a record high 209 people in the county dying from overdoses involving fentanyl in 2022. We know many deaths are due to changes in the potency of substances and the method of substance delivery. We also know that these deaths are compounded by social factors, including increased isolation, economic challenges, housing shortages and instability, and systemic racism. This is why, in Oregon, we're stepping up together to take the urgent, coordinated action needed to declare a tri-governmental fentanyl emergency, because we know we need to do more to respond. At Multnomah County, it's important we step forward with the state of Oregon and the city of Portland to establish unified, specific, measurable objectives to reduce fentanyl deaths and fentanyl activities on our streets and in our communities. Over the past 6 months, our county health department has developed an overdose response plan that includes new goals, objectives, and targets, with our primary goal to slow the rate of death from overdose. A comprehensive analysis of substance use services in Oregon completed by OHSU found that Multnomah County faces an estimated 42% gap in substance use disorder services. Declaring this emergency will help us address this and other gaps in our system, including a 98% gap in prevention specialists, an 88% gap in qualified mental health providers, and a 42% gap in school classroom-based prevention programming. Studies showed that younger people mistakenly believe that they are less likely to suffer harm or die from fentanyl use. Officials also report young people find pills appealing because they are cheaper and more socially acceptable than meth or heroin. That is why, among other strategies, our health department will launch 2 public education campaigns featuring transit, billboards, digital media, and streaming audio to promote prevention among youth and stress the effectiveness of recovery in transforming lives. These campaigns will also reduce stigma for treatment. In addition, we will increase the visibility and the coordination of our outreach on the streets, leveraging services from the Downtown Behavioral Health Resource Center to continue offering access to day services and improve connections to care. We'll increase distribution and train partners on the use of Narcan, so that more people are trained and ready to help when people need it. And we'll increase coordination across many county departments and programs to be sure our response uses all of the resources that we have. As our local public health and mental health authority, Multnomah County has worked closely with people who use drugs for decades. We partner with community organizations and service providers to develop prevention, harm reduction, treatment, and recovery support, because this has been and must continue to be a community-wide effort. As we align with the Oregon Health Authority's overdose response plan, we continue to bring the right public health focus and leadership to this coordinated response. Each level of government has identified an incident commander responsible for coordinating resources. For Multnomah County, I'm very pleased to announce our incident commander will be Multnomah County's former health officer, Dr. Jennifer Vines. We are thrilled to have Dr. Vines back at the county to help lead this effort and contribute her wealth of knowledge and expertise to this work. Additionally, effective today, I am issuing an emergency exemption to allow for the rapid procurement of needed goods and services for this effort. And the Board of County Commissioners is scheduled to declare a 90-day emergency on Thursday. I make this declaration with the expectation it will receive full support from my colleagues on the board, because I know we have a mutual interest in increased action and urgency in response to this crisis. We also have a shared priority to reduce the suffering of people who live in Multnomah County. We know that addiction is a chronic disease. We also know that with the right treatment and support, people can and do recover. Recovery is happening to someone's friend, neighbor, or loved one in Multnomah County every single day. We see people turn a corner and move towards health, wellness, and the potential that we know they're capable of. If someone that you love is struggling with fentanyl addiction, I want you to know that we hear you, we see the person that you love, we care. And we are standing together as the state, the county, and the city to increase our response to this crisis so you have more of what you need to get through this struggle. Now, I'm happy to turn the podium over to Mayor Wheeler to say more about the city's emergency declaration.
Thank you. And first of all, I want to thank the governor and the chair for this joint effort. I think this is a very worthy undertaking. I want to thank the members of the media for being here today and showing a real interest in this. This is an important issue for our community, and I'm glad to see that you agree. Now, as the mayor of the city of Portland, obviously first response and public safety will be front and center in my messaging, but I really appreciate the perspective that the governor and the chair have shared around public health, because there's a lot of intersects between what we're seeing on the streets and both public health as well as public safety. To that point, last week I announced several promising trends in 2023 crime data resulting from our work to bolster public safety initiatives. Overall, crime in Portland continues to go down significantly in key areas. From 2022 to 2023, we saw a 23% reduction in homicides, as well as significant reductions in auto theft, property crimes, and gun violence. Additionally, Downtown Portland Clean and Safe recently announced a significant increase year over year in foot traffic downtown. In many respects, we're trending in the right direction. However, we're up against a rising tide of fentanyl-related addiction and deaths that are unlike anything that we've seen before. The growing prevalence of fentanyl represents a significant threat to our community, and I know that Governor Kotek and Chair Vega Pederson share my concern about the magnitude of this crisis. The direct effects of fentanyl are undeniable and they're far-reaching. As the chair mentioned, Multnomah County has seen deaths attributable to synthetic opioids, including fentanyl, rise 533% between 2018 and 2022. Even more concerning, homeless individuals are 37 times more likely to die from a drug overdose, 37 times. And these trends are only getting worse year by year. While fentanyl has created a national crisis, it has had a disproportionate effect on Portland's central city, and particularly on our public safety and public health systems. Fentanyl wreaks havoc on the people in its grips, often rendering them lifeless on our sidewalks. It also begets violence amongst those who bring this deadly poison into our community. This devastation and human trauma unfolds on the doorsteps of homes, of businesses, and in the streets, impacting nearly everyone in this community in some manner. First responders rarely, if ever, go to a shift without responding to at least one overdose or a welfare check on a person in crisis. I've personally been out on calls with first responders and witnessed these individuals being literally brought back to life with the use of Narcan. Clearly, we have to come together to address this crisis on all fronts. Over the last few years, my administration has led multiple efforts to alleviate some of the numerous effects of the fentanyl crisis. In the last 2 years, I've issued a series of 5 emergency declarations to streamline our ability to respond to Portland's most pressing problems head-on. We've learned a great deal since the city began its emergency operations related to homelessness, livability, and crime, much of which has a direct application to the fentanyl response we'd like to see coming from these collective emergency orders. For example, my team and I created and activated the Street Services Coordination Center through an emergency declaration in March of 2022. We were able to break down silos and align city bureaus under one unified command structure. Each part of the system united to ensure a legal, practical, and a compassionate response that meets the needs of our overall community. We've been able to centralize how people can access services and provide them with the foundation to transition into permanent, stable housing through our temporary alternative shelter site program of this year, of last year. Other city efforts include a pilot partnership between Portland's Police Central Bike Squad and professionals from the Mental Health and Addiction Association of Oregon, who work in tandem to connect vulnerable people with resources in real time. Yet another example is Portland Fire and Rescue's buprenorphine pilot program, through which first responders can deliver on-scene medical treatment for opioid overdose, as well as coordinate referrals for ongoing care in substance use disorders. These concrete steps are but just a few examples of what the effective partnership can look like when coordination amongst city and county programs is strengthened. More recently, my administration also participated in the Portland Central City Task Force in the hopes of advocating for new state and county resources to bolster our continuing efforts to improve our community. I've asked for additional Oregon State police officers, a ban on the use of drugs, sobering and stabilization facilities, and an increase in supportive outreach services in partnership with our first responders and our existing outreach workers. I want to thank the governor for collaborating on increased OSP presence downtown in partnership with the Portland Police Bureau. This added support, although sporadic at present, has been a very successful partnership, and I'd like to see it become a more regular part of our community, and I'd like to see it significantly expanded based on the current success of the program. Likewise, I know there are many efforts underway to address the public use of drugs and the imperative need for a stabilization center, which I continue to support. I also appreciate the recommendations that came from the Central City Task Force that I believe are based on the strong results we've seen from our emergency systems approach, and the city has established a solid foundation upon which we can build. However, I've always been clear that the city cannot sustain this positive progress alone, and we need our government partners to be able to scale the solutions to the size of the problem. Long-term success demands increased collaboration between those of us here, the city, the county, and the state. And it also requires increased financial support that we can address the fentanyl crisis at the scale necessary. I've called for support from all levels of government to help us address the fentanyl crisis in Portland for the last 2 years. And I'm grateful that my call to action has been heard and echoed through the task force recommendations. I'm pleased to have Governor Kotek and Chair Vega Pederson join the city's ongoing efforts to address the deadly fentanyl crisis impacting our community. The partnership is a must-have. Today we move forward with urgency. We move forward together. And we're working to address these challenges together under the authority of joint emergency declarations. This is exactly the type of coordinated action which is needed to make a direct impact and a lasting difference. I'm appointing Mike Myers as the city's incident commander. Mike is a proven leader who has demonstrated time and again his ability to build teams and find solutions. Mike has led through emergencies at the Community Safety Division, the Bureau of Emergency Management, and as a former fire chief, both here in the city of Portland as well as previously in the city of Las Vegas. He will work closely with my Director of Community Safety, Stephanie Howard, who's there in the back of the room, in this effort. Unified command teams from the city, the state, and the county have already begun meeting to put this strategy together and to bring a diverse combination of backgrounds and perspectives together to find unified solutions. Over the next 90 days, we will focus on creating stronger systems of coordination for a more focused and immediate set of changes in the beating heart of our wonderful city. The city will continue acting with urgency to better connect our public safety and first response teams with behavioral health professionals to immediately and effectively intervene with those impacted by fentanyl. Through this partnership, I believe we can do many, many things, including create a centralized resource for real-time information sharing on available treatment and shelter beds, as well as a system to coordinate outreach efforts amongst the many good people trying to reach those most in need. This 90-day response is a potentially big step towards achieving a consistent, unified system that will allow us to effectively deliver these critical community services. The unified command teams are already working to establish metrics to define what success looks like and reporting mechanisms to ensure that these efforts are transparent to the media and to the community at large. And there will be more information to come in the next few weeks on that specific front. Each of us brings tools and expertise to distinct aspects of governance, all of which are necessary for holistic and lasting impact. It's time for solutions and actions, and I look forward to moving this critical work forward together. Thank you.
Blair?
Yeah, Mayor Wheeler, you just said you've been calling for help addressing this crisis for the past 2 years. So in your eyes, should this have happened sooner? And you also talk about creating relationships and support. I mean, what does that actually mean? Are there any direct steps that will be done through this emergency?
So I am very pleased to stand here with the governor and the county chair. I think we have the right combination of personalities. We are unified in our profound desire to address this fentanyl issue specifically. All three of us have committed to bringing to bear the full force of our respective governments, and that means our specialists, our streams of funding, our outreach capacity, our public safety capacity. We can't address this as a one-off, as a public safety issue without also addressing it as a public health issue. The city alone doesn't have the resources or the scale or the reach or frankly the expertise or the personnel or even the access to streams of funding to be able to solve this on our own. So it is necessary that these three governments work together and collaborate, and I'm grateful to have these two individuals in their respective roles working collaboratively with me. Thank you.
Shelby?
Governor, what is your response to DHS, a state agency, shutting down a senior living facility with very little notice to those residents?
Well, that is a good question and not germane to the conversation right here. But what I will say is the state takes very seriously the health and safety of folks in our long-term care facilities, and I'd be happy to follow up offline about the response and the timing. But if a facility is unsafe, it's imperative upon the state to make sure they are in a safer situation. So I look forward to following up on that. So.
Nigel?
Chair, you mentioned specific measurable objectives, but it sounds like the mayor just said we don't have those yet. Can you clarify whether there are specific objectives and so what they are?
Yeah, for sure. So as part of a unified command structure, one of the first orders of business are to come together to create those specific measurable outcomes that we want to see. We know that the overall goals of this is really to have a visible improvement in fentanyl consumption that's happening through additional outreach that's happening, as well as better access to treatment. So those are some of the overarching goals. What those specific strategies are going to look like and the goals associated, or the metrics associated with that, that is being developed by our three unified commanders.
Emily?
Governor,
Yeah.
Okay.
Governor Kotek,
Yeah.
we keep hearing from people looking at treatment centers that people seeking treatment are turned away because there aren't enough beds, and this has become a significant hindrance to reducing this crisis. What will this emergency declaration do to increase the number of beds available, and when and how and where and how many beds will there be? Can you speak to that, please?
Well, certainly, the long-term solution is to make sure that anybody in Oregon, not just in Portland, that is ready to seek a pathway to recovery, that they have a place to get the treatment they need. And it is an issue in communities across our state that there are not enough treatment beds. I think the thing to keep in mind in this tri-governmental declaration, it doesn't exist in a vacuum. Currently at the Oregon Health Authority, we are in the process of analyzing the gaps in needed services across the state, not just in the region. And over the next couple of weeks, we'll be seeing the results of those, and there'll be a clear plan of how we organize current resources to get more beds online, also dealing with workforce issues, and what is the longer-term solution regionally to make sure we have capacity for treatment around the state. So yes, we need to address that, but in the short term, We have three governments that are doing their part to address this crisis, but we need to work together in a different way, right? This is about alignment. This is about an emergency framework to say, hey, you're all doing good things, but can we do differently? Can we do more together? Can we make sure that the contact with individuals on the street today who are in an addiction crisis or have an addiction can have the outreach they need, can get connected to services? Yes, we need more of those services, but we have to make those first steps. What's the public health response? What is the community safety response? Can we do this together? What does the state bring to this in addition to the city and county? What you're seeing here today is saying, as the mayor has said and this chair has said, we don't do this in individual government silos. We do this together, and we're each doing our part, and we're bringing all those things to this unified command structure. So in 90 days, we will build an infrastructure of enhanced alignment and coordination that will have better outcomes for the folks who are in crisis today.
So is there a plan to add more treatment beds within the next 90 days?
I will be very honest, I don't think it's realistic to say in 90 days we're gonna have more treatment. I will say at the end of last year, through a lot of hard work, the county, the city, community partners, Care Oregon, Central City Concern, that we have more beds coming online in the middle of this year because of some very quick work in the end of last year. Is it 70 beds? 70 beds coming online. So we have more beds coming online. This 90-day emergency approach will help us better define what we need as we at the state in particular galvanize more resources and more strategic investments to make sure we have more treatment. Brandon.
For the governor and mayor, how do you see OSP and Portland Police working together to limit the supply of fentanyl on the street?
Well, right now, we want to make sure that we are maintaining the relationship that has been very fruitful between the Oregon State Police and the Portland Police Bureau, bringing in particularly bike patrol to help on the dealing with folks who are selling on our streets here. We're going to maintain that. Through this unified command, hopefully I'll have a better sense on what more could be helpful. And then I want to go back to the state police and see what resources we can provide, and also go back to the legislature. So keep doing what we're doing, understand what more could be helpful. But I have been very impressed with the relationship of the state police and the Portland Police Bureau, really addressing, holding those folks accountable who are bringing these dangerous drugs onto our streets.
Alex?
Yeah, so my understanding is this is a collaboration, this is fine-tuning kind of collaboration between different agencies that already exist, programs that already exist. It's not new money or new staff in any ways. It seems like it's a lot of programs that could have been working together maybe ahead of now. Why now? Why hasn't this been able to happen, this kind of collaboration at this level, last year, 2 years ago, when fentanyl really was ramping up in Portland?
Well, here's what I'll say, and I'd love to hear from the mayor and chair. I don't want a Monday morning quarterback why we're here and not somewhere differently. But what I can say, at the end of last year with the Central City Task Force, the focus on community safety and the desire to bring more alignment between the three governments to this issue was a top priority. Declaring the fentanyl declarations that we're doing today provide flexibility for existing resources. It brings urgency to what people are doing, but also, frankly, bringing people off their other jobs to focus here on a 90-day infrastructure approach so we can build a better coordination. And frankly, we're here now, we're doing what we are doing together. We have a brand new relationship, I think, between the city, county, and state that we haven't seen. And we're building on that, and I think we're gonna have success because we are working together in a much different way.
Yeah, go ahead, Chair.
Okay, thank you. Well, I'll just say, I mean, since my very first day in office as chair, my focus has been on building and rebuilding relationships with our jurisdictional partners, including with the mayor and the governor. And it's been a really good opportunity. I think we have a lot of things, including the additional treatment beds that the governor referred to. For me, the fentanyl crisis is something that the health department has been responding to in many ways, and we have the substance use response plan that we are actually using this 90-day opportunity to put into action some of those things that have been developed in the last 6 months because of that. But I will say this is something that we can't do as a single jurisdiction. The city can't do it alone, the state can't do it alone, right? So being able to get to this point where we are able to coordinate, where we are able to put all of these different programs and plans into action, that is important because we know in alignment, we are actually going to have a bigger impact and better results to the crisis that's happening. And I'm really glad because, you know, as the county, we are here to really give that public health, that health focused response to this, but we do that in coordination and partnership with the other work that is happening. I think one of the things that the Oregon State Police, their additional work here within the city has enabled is actually a better partnership between providers and PPV in engaging with people and making sure people get connected to resources. Those are the type of programs that we want to enhance, increase the coordination of, and then, you know, continue to have in effect.
So if I could chime in here, I think this collaboration is really important, and I think it's a terrific step in the right direction, but I don't want anybody to get the impression that the city of Portland has not been in this space working aggressively, developing programming, shifting resources, and addressing it head on. Now, our job is public safety, right-of-way management, utilities, infrastructure, and the like. But on the public safety front, we've increased the number of officers, we've increased the number of patrols, we have increased outreach workers to go out and actually communicate with and get to know people who are struggling on the streets and help connect them to services. We have moved into the behavioral space as well through our task sites and the good work that's been done with our partners at Central City Concern and also to connect people to behavioral health services, substance use disorder treatment, even public health services, and ultimately connect them to housing. And as I say, that model is working. But if we really want to scale this to the level required, then it requires all levels of government to put any differences aside, to collectively jump in and say, this is all of our responsibility and we all have a role to play. And that's what we're doing here today. But I want to be clear that we have been working in this space aggressively for quite some time at the City of Portland.
Heather.
Standing up a command center, bringing in coordinators from the city, state, and the county must be costing something. So what's the price tag and where's that money coming from?
Well, what's important for me from day one on this is let's look at our existing resources first. So we've asked each government to tap a unified command lead who has an emergency management background, who knows how to make operational decisions. Those are existing staff. State's bringing someone in, as are the county and city. We want to assess what the current resources are. And I am going to be looking to hear from the unified command and the policy people who are working with them, what else is needed, right? And then we can talk about additional resources. Sometimes under emergency declarations, you have the flexibility to take dollars from one place and move them around under a declaration. So finding out, well, can we do that? What do we need? I think we will take this week by week. As the metrics are put together, attaching what we're trying to measure in terms of what resources we need. So I would just ask everyone to keep watching what we're relaying to you about what we're learning in the process of doing this. But right now, we're using existing resources to coordinate better, and I fully expect there will be some additional asks, but right now, we don't know what those are.
Shane.
Forgive me if this question comes across as sounding a little academic, but I do wonder what precisely, or could one of you sort of elaborate on what keeps the city, the county, and the state from being able to work collaboratively and effectively on a significant crisis like fentanyl, absent of an emergency declaration? Like, what are the barriers or inhibitors that requires these dramatic steps to be taken? And sort of following up to Alex's point, I mean, we're 3 or 4 years into this crisis, so what's going on?
I'd be happy to jump in on that. First of all, let's remember that this is a recommendation of the Central City Task Force. And I think this is actually a very easy recommendation for us to accept and to implement. And at a minimum, better communication and coordination and collaboration can always be a good thing. And I think this really puts a laser focus on how we are collaborating, how we are communicating, and how we are collectively allocating resources. So I think it's helpful and a big step in the right direction from that perspective. But as we were having sort of a one-off conversation before this meeting, I anticipated that this question would get asked, because anytime anybody declares an emergency on something as important yet obvious and well covered as fentanyl, obviously one would ask the question, well, where the hell have you been? And the answer is we've been working on it. At the City of Portland, again, we have implemented new strategies, we've allocated significant funding, we've stood up new programs, we've developed partnerships with the county, we've developed partnerships with mental health and substance use disorder providers through the police bureau, through the fire bureau, and through our other efforts. We've created new ways of helping people who are addicted and on the streets be connected to the services that other governments and nonprofit providers provide. And so I want to be very clear, this isn't us waking up to the problem. We've known the problem is here. Certainly my administration, I can speak only for us, we've been very aggressively and actively pursuing solutions in this space. And I know that the county and the city, we work together every day. I know there's often a lot of focus on where we don't get together, but the truth is the city and our many city employees work daily with the county and our county partners and our public health officers and our treatment providers. And so I see this as really just an opportunity not to start from scratch, but to really give additional leverage to the work that we're already doing in the community, and frankly putting more responsibility on the three of us as elected leaders to be really engaged on a day-to-day basis in how we are addressing this crisis on our streets. And I expect that we'll learn a lot from this process that will further refine and sharpen our approaches subsequent to the 90-day emergency declaration. That's my
Mayor.
thoughts on it. Yes.
Mike Myers had one.
Oh, Mike, come on up. And
So what question was, repeat the question? Which one?
Right now.
Oh, so I think, from just an emergency standpoint, there's always a running level of an emergency within a community. So I always think about this like a high-rise fire or a wildland fire. We have a wildland fire that starts, the initial task forces and teams come together, there's a normal response, and then as we ramp up, you're systematically, you're going to see a larger growth of attention toward the problem. So I think this is just a normal process. I've seen this in gun violence. The city of Portland had a lowest level of gun violence in most cities our size across America. And over time, through 2019, 2020, we started to see an increase of gun violence together in this community. And at some point along the way, the decision makers decided that this is an emergency. And we decided that in 2022, I think you declared an emergency, Mayor, and we brought all the coordination teams together to stop that 200% growth curve and start to level that curve off. And in 2023, we brought it down. I can go over emergency after emergency after emergency within cities across America that this is the steps that you take as you see an emerging type of event, whether that is gun violence, fentanyl use, or wildland fire. This is a normal process of emergency management within an infrastructure within a state. And I think we're bringing the right team together to get it done at the right time. Thank you.
Hi. I was just wondering, what tangible actions and results can Portlanders and businesses downtown actually expect to see and expect during and after these 90 days? And can we expect to hear from all three of you as media after those 90 days are up to see what has been done?
Yeah, so appreciate that. Absolutely. I mean, I think one of the things that we want to make sure is that we're here to talk about this, to announce this today. We are going to make sure our unified commanders are available as this progresses, and then obviously when the 90 days are up, we will be talking about what has happened and what is going to be happening from that point. I think the key things that we want to see is increased visibility of outreach and engagement and interaction with people who are suffering from fentanyl or substance use addiction in the Central City area. We want to make sure that for our three governments, there is increased coordination, so better allocation of resources, better communication, and better engagement in terms of what is happening and how that is doing. As we said earlier, there's going to be an additional set of goals and metrics that'll be shared as they're developed by the Unified Command. But those are some of the things that we want to make sure. I think the presence, the engagement, the activation of resources in downtown is going to be an immediate effect.
Okay, I have time for one more
Okay,
question.
can I just quickly
Go
answer
ahead.
that? Because, first of all, yes, I'd be happy to talk to you afterwards. So one of the things I personally hope to get out of this declared emergency between the state, the county, and the city is a longer-term strategy. Obviously, in 90 days, we're not going to solve the fentanyl crisis in Portland. It is going to be with us for years. And so what I'm hoping we do is we develop longer-term strategies to sustain our efforts community-wide. What do I mean by that? We did our 90-day, I'll give you a very concrete example. We did our 90-day reset in the central east side. It was very successful. At the end of the 90 days, the perception some have is that those resources have not been sustained as we've had to focus on other hot spots across the city. And as a result, some of the people in the central east side feel that we have not provided the same level of service. And there's probably an element of truth to that. So what I hope happens from this is we learn a lot from this at the City of Portland about what we are calling Portland Solutions, which is a city-wide effort mirrored on the successful 90-day resets that would be sustainably supported, sustainably funded, citywide, permanently, so that we don't have this impact that we go in and focus on one area and a lot of people just move to a different area and make that area problematic. And then when we go into that area, they disappear, but when we leave, they come right back. We have to be consistent, we have to be community-wide, and we have to be permanent in our focus. And this will really help us, I think, sharpen the approaches that we need to be successful. I hope to learn from my colleagues in their respective governments, and we have a lot that we think that we've learned along the way that would be useful not only for the City of Portland, but for the entire state and perhaps even the region. Sorry.
Okay, I have time for one more really quick question. I have 3 reporters I haven't heard from. I saw Amanda's hand going first, so Amanda.
All right, thank you. In the emergency declaration, it talks about streamlining licensing and certification of healthcare professionals. Wondering if any of you could talk about which healthcare professionals specifically that's addressing and what's been delaying their certification process up until this point.
Thank you for pointing that out. That was an important piece for the state to add in our emergency declaration. What we've been hearing from providers is some folks who have been languishing in licensing renewals or licensing certification at some of our, like the Social Work Board, the Mental Health Regulatory Agency, the Medical Board, you know, the folks who keep people safe by saying, yes, you can practice in the state of Oregon. So by adding that to the declaration, we are going to explore new flexibilities that could potentially move people up the queue. For example, if we have a local provider that says, look, I've got 3 people who could go tomorrow if they got their background check done, let's figure that out, right? We have seen improvement since I've been in office from our licensing boards. The Social Work Board, for example, has cut in half their backlog to get people through the process. Remember, our licensing agencies are primarily funded by the fees for the people who are licensed, right? We have to think differently about giving them the resources to move people through licensure in an expedient way that maintains safety. But let's make sure that if we have people who want to provide services, that there is not a barrier on the licensure side. So that is, we're gonna try to be creative and flexible. An emergency declaration gives you additional tools to see if we can do things a little quicker or focus differently. But that is one thing we've been hearing from providers is like, look, we can't get the people, your licensing boards are a problem. That's what we're gonna be addressing.
Okay, adjourned.
Thank you.
Thank you, everyone. Keep asking questions, we will be here. We'll let you know how things are going, so thank you.
Governor, are you able to, actually, by the way,
Sorry that I had to go hard here.
No, you're talking about the one.
yeah, do you have a